My name is Sanjay Gupta. I'm a cardiologist in New York. Today's video is entitled Logical Trespasses in Medicine When Sound Thinking Leads to Unsound Care. So today I want to talk about something subtle, so subtle in fact that we often don't see it at all. In medicine, we like to think we follow logic, we follow evidence, we follow reason. But the truth is, even the most logical path can take us to the wrong destination if we don't stop to examine how we got there. What I want to explore with you today are what I call logical trespasses in medicine, moments where our thinking sounds right, feels right, but still leads us somewhere deeply wrong. Let's get started. Let's begin with the most famous trap, correlation and causation. Correlation isn't causation. We observe, for example, that people with high cholesterol develop heart disease. So we conclude that high cholesterol must cause heart disease. But perhaps they're both caused by something else entirely. Perhaps the cholesterol is more marker than murderer. We see this everywhere in blood pressure, in insulin resistance, even in anxiety. Symptoms become explanations and observations become assumptions. And yet, the body is rarely that simple. Number two, lowering the number must lower the risk. We take something we can measure, like HbA1c levels or blood pressure, and assume that if we force that number down, we will automatically reduce harm. But studies have shown that aggressively lowering HbA1c levels in elderly or frail patients can increase mortality. Aggressively lowering blood pressure in frail elderly patients can actually make them worse, increase the risk of falls, increase their morbidity. Because the number isn't the disease, it's only the trace it leaves behind. When we treat the number and forget the person, we commit a trespass against logic and a disservice to care. Number three, the guideline fallacy. It's in the guideline, so it must be right. But who wrote the guideline? What population did it study? What assumptions did it carry? Guidelines are important, but they're maps, not mandates. Following them blindly is not science, it's bureaucratic obedience dressed as reason. Number four, no evidence equals no truth. This one is insidious. When a patient describes relief from something unorthodox, diet, supplements, pacing, cold water immersion, we say there's no evidence for that. What we often mean is no one has funded the study, no one has published the paper, no one has looked. Absence of evidence is not evidence of absence, and to treat it as such is to turn logic into arrogance. Then there is the hindsight bias, the retrospective trap. We tell families, oh, if you'd only come in sooner. We tell patients, if you'd only controlled your diabetes better. But this is not wisdom. This is hindsight masquerading as foresight. We forget that every decision is made in fog. And when we pretend it wasn't, we wound those who already carry enough pain. Anchoring and the stickiness of the first label. So a young woman faints, the ECG is normal, she's told it's just anxiety. Years pass, symptoms escalate, the label sticks. We stop thinking, we stop asking, the diagnosis has anchored itself, and it's now steering the ship, no matter how wrong it may be. This is not just a logical trespass, it's a human trespass. Then there is the myth of the single cause. Modern medicine loves linearity. One disease, one cause, one cure. But the truth is, most chronic illness is non-linear, multifactorial, and dynamic. If fatigue is not caused by just one thing, heart failure is not just about fluid and a reduced ejection fraction, and depression is not just serotonin. We oversimplify to create comfort. But comfort isn't clarity, and simplicity isn't truth. Logical trespasses are not committed by bad doctors. They are made by good people working under pressure, trying to find answers in a system that rewards speed, certainty, and compliance. But medicine is not just a science of knowing, it is a discipline of thinking. And if we're to do better for our patients, we must become students of our own assumptions. We must learn where our logic takes a wrong turn. Because healing begins not just with answers, it begins with asking better questions.